Welcome to EyeOnVision. Today with Dr. Sachin Mehta of Retinal Consultants of Arizona. Our topic today is going to be age-related macular degeneration, better known as AMD. Welcome, Dr. Mehta.
Thank you very much.
This is a pretty common disease, isn't it?
It's very common. As a matter of fact, it's the most common cause of legal blindness in the industrialized world, and it tends to affect people over the age of 65. So obviously here in Lake Havasu, it's a very, very important disease to diagnose and treat appropriately.
Yeah, tell us some basic facts about AMD.
Yeah, so
and detection.
Yeah, macular degeneration, like I said, is very common, and early detection is actually very, very important in the diagnosis and the treatment of the disease. So basically, you know, when you come in for an evaluation, we can do a non-invasive exam looking at signs and symptoms of macular degeneration. And if you have those signs and symptoms, then we can initiate treatment based on how severe it is. You know, so it can go from very, very mild, it can cause a very mild visual impairment, and it can also cause a very severe visual impairment that requires intraocular injections or injections inside the eye. Sounds awful, but believe it or not, we can do it pretty painlessly.
Oh, that's good. Yeah, there's so many things with the eye now that they can do with lasers and things like that. Are some of the treatments drugs? Any drugs related as well?
So for dry macular degeneration, which causes more of a mild visual impairment, especially early on, you can treat that with just some multivitamin therapy as well as some lifestyle modifications, avoiding smoking, things of that nature. For wet macular degeneration, that is when you get fluid and blood underneath the retina, and the retina is like the film of the camera. You know, it captures the image and sends it back to the brain so we can see. And it's the center of the retina that tends to degenerate in macular degeneration. So when you get that fluid in the blood in the back of the eye, that causes a lot of distortion in the vision. So we start injecting the retina with medicine, and that can actually reduce the amount of fluid in the back of the eye. It can help the film of the camera, so to speak, kind of smooth out, and therefore you can take a clearer picture, and most importantly, prevent irreversible blindness.
Is it is it relation involved? Like if your family has it,
yes.
is it generational?
So it tends to affect people over the age of 65, and it tends to affect Caucasians more than other races. But if you have a strong family history of the disease, you actually might see it earlier, maybe even as early as age 50. And in those patients, we want to be very aggressive with our treatment because obviously they have a lot of seeing left to do in their lives.
Okay, so that's primarily who is at risk. And how do I know if I have AMD? What will happen?
So basically, you might wake up one morning and you notice that there's a portion of your vision that's missing or distorted in one or both eyes.
Really?
So this can happen just spontaneously without any prior history or event. And like I said, it tends to affect people over the age of 65. So if you wake up one morning and one of your eyes just isn't seeing quite that well, you may want to consider getting it checked out. And we have some excellent resources here in Lake Havasu.
That's good to know. And quickly, some treatments available. We talked about some injections.
Right.
What about, wasn't there an implant available as well?
Yeah, so this is for end-stage macular degeneration. For people that have lost significant vision in both eyes from macular degeneration, there's a special implant that you can perform during cataract surgery. It's an implantable miniature telescope. You implant the telescope into the eye, and what it effectively does is basically reduces the size of the central blind spot in the affected eye.
Wow.
So then one eye becomes your peripheral vision eye. That's the eye that wasn't treated with the telescope. And the eye that's treated with the telescope becomes your central vision eye. And the brain learns to adjust to this modified monovision.
Wow, that's cool. Technology today, doing great things.
Thank you.
Well, thank you so much. If you have any questions, see your eye doctor, correct?
Absolutely. Come and see us anytime. We're at
Retinal
Lake Havasu
Consultants.
Family Eye Care and right here in Lake Havasu.
Okay, we will. Thank you, Dr. Mehta.
Thank you.
We'll be back next time.